Hi class, we're done with the skeletal system, so we're on to articulations. You've seen that term before, articulations. You've seen it in articular cartilage, superior articular facets. An articulation is just a joint. What is a joint? A joint is where two or more bones come together and articulate. So basically, an articulation is the same thing as a joint. A root word, A-R-T-H-R, whenever you see that, that just means joint. Arthrology would be the study of joints. Arthritis would be inflammation of joints. So we're going to be classifying joints in two ways. And you'll see this all through anatomy. We're going to classify them functionally and structurally. Now, functional classification of joints is going to be based on the amount of movement that is allowed at that joint. If a joint is synarthrosis, it means it has no movement. It is immobile. If it is amphiarthrosis, it's a slightly movable joint. If it is diarthrosis, it's a freely movable joint. Just figure out how to spell A-R-T-H-R-O-S-E-S and then put either syn in front of it. Syn would mean without, no movement, synarthrosis. Amphi, a slightly movable joint. And if it's diarthrosis, it's a freely movable joint. Structural classification. We're talking about the anatomy, right? Structural. How is it built? What is the material that is binding the bones together? And does it have a joint cavity, a space in between the two bones? If it is a fibrous joint, the bones are joined together by fibrous connective tissue. Fibrous joints joined by fibrous connective tissue. There is no joint cavity. An example of a fibrous joint would be the sutures between the bones of the skull. Cartilaginous joints. The bones are held together by cartilage. And again, there is no joint cavity. There's no space in between the bones. An example would be the fibrocartilage that you saw in your pubic symphysis. And lastly, the synovial joints. Here, the articulating bones are separated by a fluid space. It's a fluid-containing space. It is a joint, and it does have a joint cavity. That is the space. An example would be your knee joint. So let's look at some of these. So with our fibrous joints, the ones that my class has to know, there's others, but for my class, you just need to know the sutures of the skull and the gomphoses. Gomphoses are it's held together by a fibrous connective tissue. What's held? The root of your teeth. They are, remember you had your alveolar margins in your mandible and maxilla? Well, the teeth are held in those pegs in the mandible and maxilla by dense fibrous connective tissue. That should be immobile. It should be immobile. And of course, the sutures of the skull. You saw those. That is dense fibrous connective tissue. So these two fibrous joints, the sutures of the skull and gomphoses, functionally they are synarthroses, immobile, and there is no joint cavity. Cartilaginous joints. That's their structural classification. They are held together by cartilage. The ones you guys need to know, the pubic symphysis and the intervertebral disc. These are both fibrocartilage. Functionally, these are amphiarthroses. They are slightly movable joints, and again, no joint cavity. There's a little bit of mobility here, which will come in handy when you're carrying a baby and having a baby, and a little bit of mobility here when we're moving our spine. Now, synovial joints, that's the structural classification. They all have a synovial joint cavity, and they are all diarthroses. They are all freely movable. Examples: the shoulder, elbow, wrist, hip, thumb, ankle, knee, the interphalanges, the intercarpals. All those are freely mobile joints. Some have more mobility than others, and we'll take a look at that. But first, you need to be able to understand the features of a synovial joint. This is in your worksheet, so make sure you label it and you understand it. So we have our two bones that we're going to be bringing together. They are separated by a synovial joint. This is our cavity, and they are capped at both ends with articular cartilage. What kind of cartilage? Hyaline cartilage. What's unique about synovial joints, this cartilage is not surrounded by perichondrium. So that's going to be important, because we need to figure out how they're going to get their nourishment if there is no perichondrium. I already said this was the synovial joint, the cavity, the space in between the bones. Within this synovial joint cavity is going to be synovial fluid, and we'll talk about that in a little bit. The next structure is going to be the articular capsule. Now, this capsule is made up of two layers. This outer layer, it's a fibrous layer made up of dense, irregular connective tissue, and this dense, irregular connective tissue is going to be inserting into the periosteum of one bone, go over the synovial joint, and go into the periosteum of the other bone. The inner membrane is called the synovial membrane. Now, the synovial membrane completely surrounds the synovial joint except where there's articular cartilage. It basically starts right where the articular cartilage ends. This synovial membrane is loose connective tissue. And actually, it's areolar connective tissue. So it is the fibroblasts in this areolar connective tissue that are actually making the synovial fluid. Now, synovial fluid, it looks just like the whites of an egg. So if you have a raw egg, that is what, in the white part of that raw egg, that is what synovial fluid looks like, and that's why they call this synovial, because that's what the egg part is. The white part of an egg is called. So what are the functions of the synovial fluid? Well, it's going to lubricate the joint. It's going to give it some more lubrication. It's going to help reduce that friction. And since it's a fluid, it's going to act as a shock absorber too. But it's also supplying the nutrients to the articular cartilage, which is important because these chondrocytes need oxygen and nutrients to survive, and they're getting it from that synovial fluid. And lastly, there is going to be reinforcing ligaments that join these two bones together. I kind of drew them in here, not very well. You can draw them in on your worksheet too. And this is just going to make this union between these two bones even stronger. So other structures that can be present in synovial joints are going to be menisci. They're found in the knees, the knee joint. We have talked about this before. This is the meniscus. We have a medial and lateral meniscus. Menisci is plural. This is a fibrocartilage pad that is in between the two articulating bones of our knee, the femur and the tibia. This is still hyaline cartilage, so we still have our articular cartilage here and articular cartilage in the tibia, but we have an extra fibrocartilage pad in there too. That is the menisci. And then we're going to have bursae. Bursae are put in these joints, especially joints that are moving a lot, that have a lot of movement. We're going to add extra pads, and this is basically a bag of synovial fluid. So they're going to be stuck in the big joints that have lots of movement. So the bursae, bursa is singular. And then there's something called tendon sheaths. Now they are going to be wrapping around tendons. If you look at your hands and your feet, there are so many tendons going to the digits of your hands and your feet. If they are all moving, they would be causing friction. They'd be rubbing against each other. So they're going to wrap the tendons in these tendon sheaths, which are basically bursa. That's what they are. They're just more lubrication to prevent that friction from all these tendons moving. So, movements at synovial joints. We're not going to be talking about synarthroses. We're not going to be talking about amphiarthroses. We're going to be talking about diarthroses, aka freely movable joints, which are all synovial joints. So from now on, everything we talk about is related to a synovial joint. When we get to the muscular muscle system, they are going to be crossing synovial joints to cause a movement. So let's look at those movements. Now, there's multiple movements we're going to be talking about. You got to understand them, and hopefully you will do these with me while we're going through them on yourself so you can understand how your body is moving. In class, I have you stand up and we do all these movements together. So hopefully I can help you do these movements while you're at home. We're always going to be relating these movements to our anatomical position. So remember your anatomical position. And these movements are paired. And they're usually an opposite movement. So it'll make more sense once we go through them. So our first paired movement is flexion and extension. And you have a little handout that I gave you on all the movements of the synovial joints. So you should have that out with you too. So flexion and extension. Flexion is a movement that decreases an angle of the joint, and extension is a movement that increases the angle. Oh boy, increases the point joint angle. Jeez, been a long day. So let's look at flexion and extension. First one up, the elbow. Easy, easy, wheezy. When you are in the anatomical position, your elbow is straight. That is extension. When you bend your elbow, so bend your elbow up, that is flexion. When you put it back into the anatomical position, that is extension. So flexion, extension. You are bending the elbow with flexion, and with extension, you are putting it back into the anatomical position. So if you were at the gym and you were doing biceps curls, here the elbow is completely extended, and then you are doing flexion to bend that elbow and pull up that weight. Here, the elbow joint again, we're only looking at the elbow joint. It's extended, and we're going to bend it. Doesn't matter which way. It looks different than this, but this is still a bending, so this is flexion. So flexion, extension. Easy to see on the elbow. Now the knee. Oops. In the knee, if you are in the anatomical position, you are standing up and you bend the knee, that is flexion. That is flexion. So easy to see you've decreased the angle right here. And then when you put your foot back down, that's going to be extension. So flexion and extension, flexion and extension. Easy to see here. You've probably, if you've been to the gym, you know this is the knee extension machine, the quad machine. Here we are. Her knees are bent. So this is flexion, and then straightening out the knees, that is extension. So always remember, extension, the joint is straight. Flexion, the joint is bent. So make sure you know that one too. We got lots of them here. Now with the neck, you can do flexion and extension of the neck too. So if you are in the anatomical position and you are looking straight forward, like here and here, if you look down on the ground, or you're just looking down, that is flexion. You've decreased the angle right here. You've decreased the angle. When you go lift your head back up into the anatomical position, that is extension. You are back in the anatomical position. If you continue with that movement and say now you're looking up in the sky, that is hyperextension. You've gone beyond the anatomical position. For us, I'm never going to ask you about hyperextension. Just know this is flexion, extension, flexion, extension. So pretty easy on the neck. Here it's showing you what's happening. So this is flexion and this is extension, or you could call it hyperextension. But for me, you can just call it extension. Now, when we get to the shoulder, we're talking about the glenohumeral joint. So we're talking about the glenoid fossa and the head of the humerus. That is the shoulder joint, the head of the humerus in that glenoid fossa. Flexion is a forward movement in the sagittal plane. So if you are sitting down, just move your arm straight forward in front of you, straight forward in front of you. The action at that shoulder joint is flexion. If you go back to the anatomical position, that is, you're going back into extension. And if you lift that shoulder joint, if it goes all the way to the back, straight back, that is extension. They're calling it hyperextension. Just call it extension. technically what they're saying with hyperextension, it's beyond the anatomical position. But so flexion, extension. I think I have some other pictures to show you. So here you can see we're just looking at the shoulder joint. This is flexion. The arms are straight in front of her. The shoulder joint. We're looking at the action at the shoulder joint. Here, looking at the action here, this is extension. The arms are now pulled back, straight back. Flexion, oop, and then extension. Extension right there. Same thing with the hip. If you are in the anatomical position and you lift your leg up, that is going to be flexion. If you bring it forward, that is going to be flexion. If you kick it back, that's going to be extension. So I'm sure I have other pictures I wanted to show you. So this is a good one. She's in the anatomical position, basically. This is flexion of the hip. Do not look at what's happening at the knee. The hip is still forward, right? The hip is still forward. That's all you're looking at. If you're saying hip flexion, you're only looking at the hip. Pay no attention to what's happening at the knee. Same thing here. If you're laying down and you bring your leg up, this is still hip flexion right here. Hip flexion. Forward movement at the hip joint. Anatomical position, you kick that leg back. That is hip extension. The leg is now behind you. Same thing here. If you're laying in the prone position here and you lift that leg up, that is hip extension. We're only talking about the hip. So almost everything, flexion is always going to be forward, extension is back, except for in the knee. It can't go forward, it can only go back, but everything else is a forward movement for flexion, and everything else is going back with extension. So here we have the vertebral column. So your back, the vertebral column. You can, in the anatomical position, you're standing straight. If you bend forward, forward is going to be flexion. If you stand back up, that is extension. And then if you continue to bend back, that is hyperextension. So flexion, extension. Here he's showing you this is flexion. Flexion, forward movement. Extension, you're back in the anatomical position. Hyperextension, you're bending back. I would just say here you are in neutral position. Flexion, extension. Flexion, extension of the vertebral column. Anytime you use these terms, any kind of movement term, you always have to say of what? Flexion, extension of the vertebral column. Flexion or extension of the hip joint. Always make sure you put the joint that is involved. So, wrist flexion and extension. This is happening at your radiocarpal joint, your wrist joint. Remember, radiocarpal joint, the distal end of the radius and the scaphoid and the lunate. That is your radiocarpal joint. So, if you are having flexion, if you are in the anatomical position, so go ahead and put your wrists in the anatomical position and bend them forward. That is flexion. If you bring your wrists up in front of you and look at them, it will look like this. This is flexion. This is in the anatomical position. It would be straight. This is flexion. Go back to the anatomical position with your hands and push them backwards. Push them backward. Bend it back. That is going to be extension. Bring your hands up in front of you. It looks like you're saying stop. This is extension. You have to figure these out. It's real easy if you are in the anatomical position. Flexion is forward movement at that wrist. Extension is going to be backward movement at the wrist when you're in the anatomical position. So this is what? This is flexion. This is extension. What is this at the wrist? This is flexion. If you can't see that, go ahead and figure it out. Do it on yourself. So what do we have here? This wrist is in the extended position. You can always figure this out too. If you're ready to catch yourself falling down, you're going to have your wrist in the extended position. So let's see, what do we have next? Lots of flexion and extension. I think I'm giving you examples of every single joint you need to know because you need to practice them on yourselves. So flexion extension of your metacarpal phalange joints and your interphalange joints. So remember your metacarpal phalange joint, MCP joint, that is where your metacarpal and your proximal phalange come together. So this is going to be your knuckles, right? So when you have flexion, you're making a fist. Everything is bent. Everything is bent. So this is all flexing. When your fingers are straight, that is extension. So flexion and extension of the metacarpal phalange joints and your interphalange joints. Well, it's been almost 30 minutes, so I think we're actually going to stop here. So try to go over all these movements with just flexion and extension, and then we'll go on to our other paired movements in the next video. But that's going to be it for this video.